Okay, so today we're jumping into a topic that you've probably heard a million times, but maybe don't know the full story on Botox. We're going to get into the what, the how, and the why of this fascinating treatment.
It all really boils down to this one kind of mind-blowing question. How did one of the most powerful toxins known to science become a go-to multi-billion-dollar treatment for, well, everything from wrinkles to migraines? It's a wild story, and to get it, we need to go way back.
So first up, let's talk about the pretty surprising history of how this stuff went from a dangerous substance to a super precise medical tool.
What's so amazing here is the journey. For well over a century, this was just known as the scary bacteria that causes botulism. But then, in the 1980s, a doctor figured out that a teeny-tiny, super-purified amount could actually help with eye muscle disorders, like crossed eyes. That was the game changer. That medical breakthrough is what opened the door for its famous cosmetic approval in 2002, which, basically launched an entire industry.
Okay, so that's the history, but how does it actually work its magic? Let's get into the science of smooth. And don't worry, I'll make it simple. At its heart, Botox is what we call a neurotoxin. But in this purified form, it's designed to do one very specific job: temporarily block the conversation between your nerves and your muscles. And temporary is the key word here.
Think of it like this. Your brain sends a command down a nerve, that's the highway, telling a muscle to tense up. Well, Botox is like a temporary roadblock on that highway. The signal can't get through. And if the muscle never gets the message to contract, it just stays relaxed. And when the muscle is relaxed, the skin on top of it smooths out. It's actually pretty straightforward.
And that exact same mechanism, blocking a nerve signal, is why Botox is so much more than a cosmetic thing. It can block the nerve signals that cause chronic migraines, tell overactive sweat glands to chill out, and relax those powerful jaw muscles that lead to painful grinding. It's a true medical workhorse.
All right, so you get the science, but what's it actually like for a patient? Let's walk through the journey, from the first chat to the actual injection.
And this is absolutely crucial. Any good treatment begins right here, with a detailed conversation. A great provider is going to look at how your specific muscles move, talk about your history, and really understand your goals. This isn't a one-size-fits-all thing at all. It has to be personalized.
This is where it becomes a mix of art and science. A skilled injector is an expert in anatomy. They're targeting these tiny, specific muscles, like the frontalis for your forehead or the corrugator for those 11 lines between your brows, while making sure to leave all the surrounding muscles alone so you can still make natural expressions. We're talking about a game of millimeters here.
And let me be perfectly clear on this. This is a medical procedure. It is not a casual spa treatment. The training, the credentials, and the experience of the person holding the needle are everything when it comes to getting a safe and amazing result.
Okay, so the injections are done. Now what? What can you actually expect to happen next? Let's talk results and recovery.
So one of the biggest myths is that this stuff is instant. It's not. As you can see, it takes a few days for that roadblock to really get set up. You'll usually see the full peak result at about the 2-week mark. And from there, it typically lasts for about 3 to 6 months before your body just naturally processes it and your muscle function goes back to normal.
Your aftercare instructions are usually pretty simple, but they're super important. The whole goal here is to keep the Botox exactly where it was placed, right? You don't want it to move. So that's why you don't rub the area, you stay upright for a few hours, and you skip that high-intensity workout for a day.
All right, let's wrap this all up with what is truly the most important takeaway here. When it comes to Botox, it is always, always about safety first.
It really all boils down to these 3 things, and you'll notice a theme here. They are all in the hands of your provider. Knowing the anatomy inside and out, using a less is more approach with the dose, and having the skill to place that needle just right. That is what makes all the difference.
At the end of the day, it's about so much more than just having a steady hand. It's like this says, real mastery is that perfect blend of science, technique, and just really great patient care.
I mean, think about it. To go from a feared toxin to a medical and cosmetic powerhouse is just incredible. And its story is far from over. We're seeing it used for new things all the time, from skin texture to jawline contouring. It just makes you wonder, what's the next frontier for this remarkable molecule?